Okay, so moving on to the dorsiflexors of the foot and ankle. These pretty much reflect what the deep plantar flexors do. So where we've got a tibialis posterior, we've got a tibialis anterior. Where we have a flexor digitorum longus, we have an extensor digitorum longus. Where we have a flexor hallucis longus, we also have an extensor hallucis longus. The only exception is that we also have a fourth little muscle which strictly speaking should belong to the evertor group, called peroneus tertius. Okay, so this muscle we've got here is tibialis anterior, and just like tibialis posterior, it gets its name from the fact that it attaches from the anterior tibial surface. It actually arises from the upper 2/3 of the anterior tibial surface and adjacent interosseous membrane. It's a very tough muscle, again covered in a very thick layer of deep fascia, and tibialis anterior is very prone to compartment syndrome. Overuse of this muscle can often lead to a significant increase in pressure in the anterior tibial compartment. The tendon runs down over the anterior aspect of the ankle and under the extensor retinaculi. The tendon is clearly palpable. As we dorsiflex our foot, it's the tendon that bowstrings out the most. Its distal attachment is onto the medial aspect of the underside of the medial cuneiform and the base of the first metatarsal. So we can see here it's come all the way down to the end of the midfoot here. So it hooks round on the underside of these two bones, base of first metatarsal and medial cuneiform. There are two muscles on the outside here, peroneus longus and peroneus brevis, and peroneus longus comes across and it meets it. Together with peroneus longus, tibialis anterior forms a stirrup for the foot that holds the arches of the foot up. It has a significant dynamic role in maintaining the architecture of the foot. Extensor digitorum longus basically lies lateral to tibialis anterior, so it's this long thin slip of a muscle. It has a fairly extensive proximal attachment. It attaches a little bit from the lateral condyle of the tibia to the anterior aspect of the head and neck of the fibula and the anterior aspect of the shaft of the fibula, about the upper 2/3, and takes a few fibers off the anterior aspect of the adjacent interosseous membrane here. The tendon again runs down. It runs over the dorsum of the foot under the extensor retinaculi, lying in its own synovial sheath, and as it enters the foot, it splits into 4 separate tendons, and each of these 4 tendons pass distally to attach onto the middle and distal phalanges of the 4 lateral toes. Now, as the tendon itself passes over the heads of the metatarsals here, it creates an expansion. It creates a fibrous sheet that hangs over the heads of the metatarsals. This is known as the dorsal digital expansion, and the dorsal digital expansion is important because of some of the other muscles that blend into it, muscles like the lumbricals. Unfortunately, we've lost dexterity in our toes. Our toes have become these short and rather non-dexterous structures. But in the hand, the dorsal digital expansion and lumbrical relationship is identical, anatomically identical to what we've got down here. The lumbrical, the arrangement between the lumbricals and dorsal digital expansion is important for fine dexterous movements. Now, some people are capable of developing that fine dexterous movement in their toes as well, and again this arrangement then becomes more important. Again, arising from the anterior aspect of the fibula, from the lower to middle half really, is again a short strong muscle called extensor hallucis longus. It also takes a few fibers again from the interosseous membrane, passes down under the extensor retinaculum, crossing the foot before it goes all the way to the distal phalanx, attaching to the base of the distal phalanx of the first toe. Its action is to dorsiflex the big toe, but it also plays a secondary role in dorsiflexing the ankle as well. And here, lateral to extensor hallucis longus, we can see the muscle I was describing earlier, peroneus tertius. This is a small muscle that anatomically sometimes gets grouped in with extensor digitorum longus. Arises from the lower third, lower quarter of the anterior aspect of the shaft of the fibula and adjacent interosseous membrane, passes under the extensor retinaculum before attaching to the medial side of the base of the 5th metatarsal. Now, the nerve supply of all of the dorsiflexors is via the deep perineal nerve roots L4, 5, S1. And sometimes the deep perineal nerve, well, in actual fact, the origin of the deep perineal nerve, as it winds around the neck of the fibula here, can get impinged, which can then lead to a drop foot, an inability for these dorsiflexors to contract. On the lateral aspect of the lower leg, we have the evertors of the foot. These are the perineal muscles. They used to be called the fibularis muscles because they arise from the fibula. There is peroneus longus that we can see here, and peroneus longus arises from the lateral aspect of the upper 2/3 of the shaft of the fibula, forms a long tendon that passes behind the lateral malleolus, passing underneath the superior extensor retinaculum, through the inferior extensor retinaculum in its own tunnel. It passes underneath cuboid, lying in a groove on the underside of cuboid, before going across to meet tibialis anterior to attach onto the plantar aspect of the medial cuneiform and base of the first metatarsal. Peroneus brevis, on the other hand, lies deep to longus, deep and inferior to longus. Again, this arises from the lateral aspect of the lower 2/3 of the shaft of the fibula. Runs down again behind the lateral malleolus and under the two retinaculi, before inserting into its distal attachment here, which is onto the styloid process or the tubercle on the base of the fifth metatarsal. The nerve supply of both the peronei is the superficial perineal nerve roots L5, S1. Now, both of the evertors of the foot have an action of plantar flexing and everting the foot.